So right now I am about to talk about one of my most favorite subjects, which is what is a dental implant. And the reason why it's one of my favorite subjects is because it's one of the, I would say it's one of the biggest myths in dentistry about this horrible thing that painful and all of that, and how it's actually quite the complete opposite, at least in my hands. So let's talk about what an implant is and go a little bit over the details of, what to expect if you need a dental implant. So first of all, a dental implant is simply a root replacement. So let's say for any reason you unfortunately lost a tooth. An implant is the replacement of the root. So it's a titanium biocompatible material that we put replacing that root. Of course, totally customized, depends on your specific dimensions, and we do all kinds of reparations for it. But the reason why it's one of my favorite things is because it's one of the most predictable things we do in dentistry. So just imagine that we do hundreds, thousands of different procedures in dentistry, and this is one of the most predictable things that we do. So how amazing is it that we have in our hands the capability of replacing a body part that you lost, because a tooth is a body part, and then we're able to replace it with one of the most predictable things. Now, my specific success rate is easily 99%. And if you really think about it, what in life or what medical procedure that we do has that high success rate? So that's why I am really excited to talk about it. Not only because it's actually quite fun to do, for the provider, for me at least, it's one of my favorite things to actually perform. But for the patient, it's actually the complete opposite of what people think. So a lot of patients will come to me and say it's just the idea of something like being screwed in like my jaw and my bone, and it's like, I promise you, it's nothing like that. There's actually quite a lot of very common dental procedures that we do that you'll feel a lot more than when we actually place an implant. The reason being, in most cases, of course, there's a huge complexity case and there's the very simple cases, but I would say from simple to moderate, for the most part, dental implants are very straightforward, very, very easy. In terms of what you'll feel, this is what I'll tell my patients. Bone itself, inside, doesn't really feel any pain. So what really feels pain is that layer that's on top of bone that has all the innervations and all the vascularity, so all the nerves and everything is around that little layer that's on top of bone. Now, in the mouth, that's the area that's the easiest to numb. It's actually the first thing that gets numb when we numb you guys for a cavity or a crown or something like that. So in my hands, comfort is the number one thing. But I assure you, it's most of my patients will be like, that was it? That's really what it was? Like I said, of course, it's a range of things, and when somebody needs like something incredibly complex, then that might be a different experience. But for the most part, in fact, I've done very, very complex implant cases as well. And I can't recall, I don't have one patient that has told me that it's been a bad experience at all. That's a good track record to keep. I hope I stick to that for the rest of my life. But it all comes down to the planning. It all comes down to us, the providers, and how we're planning and how we prepare for your case. So this is what you'll feel, and this is literally what you will feel. Depending on where you're at, depending on where the implant that is needed, we will numb the area. And we'll numb the area just like we numb the area for filling, for a crown, or anything like that. Depending on your case, some people like some sort of sedation, so mild sedation, conscious sedation, nitrous, things like that, or something that you can take. But for the most part, my patients are just completely normal, as if they go for a cavity. And once you get numb, you're gonna feel, I am gonna be working and you're not gonna be feeling anything. But I think the most common thing that you will feel is a little bit of vibration, salty water as we're going through. It's truly, most of the time, is more the measurement or maybe taking x-rays to confirm our position and make sure that everything is perfect. And once again, that's rare. Maybe you'll get one throughout the procedure. If we're able to do your case completely digitally guided, so we planned it digitally, we have a guide. I am not joking. Literally, the procedure might take about 5 minutes. Now, of course, this is very complex dentistry that I am oversimplifying, but the truth is, in the right hands with the right treatment preparations, it's a very simple thing. Once we place the implant in place, if it's a back implant, we'll probably just place the implant, we'll protect everything. Sometimes you need a little bit of grafting, bone grafting. Usually that sounds so much more than what it is. You won't even feel when the bone grafting is happening. Sometimes you need 1 or 2 stitches, sometimes you don't need anything. Then we just wait for your body to take that implant as if it's your own, and we call it integrated. It completely integrates. Think about it like the bone is shrink wrapping around this brand new root replacement that's made of a very biocompatible material. Now, I personally use the absolute best for my patients. I use on you what I have on me. The kind of implants that I use is a Straumann brand, and I'm super proud of using the best for my patients, because ultimately, if I were to use something different on me than on you, it's there's a lack of transparency there. So I use the best for you guys. I only use original parts, and I think I owe a lot of my success rate to not only being very careful with the planning and choosing the cases, but I'm also very strict about the kind of the brand that I use, and that I don't use any knockoffs or anything, any aftermarket parts to it either. Also, the labs that I use, they know that I only use original parts. And I think that's incredibly important, because there's such a big range of price in the implant department, and you'll hear such a big range. And truthfully, ultimately, it's your body, and ultimately you need to decide what you want to do. But I personally would not want anything in my body that was an aftermarket or like something cheap. I want the best that's out there. Why is that important? Because sometimes something that's cheap ends up being super expensive. Meaning, if a patient decides that maybe it's not the right thing because of the price, and they're shopping around, you need to make sure that you're shopping apples to apples. I do have several patients that throughout the years, so remember, it's been 13 years of placing implants. I do have several patients that have chosen to either get treatment back in their country. It's, of course, when you change the currency exchange, then it becomes a lot cheaper. But remember, this is an actual surgery. I am minimizing the experience, because in my hands I am very careful to be incredibly gentle and to do the least amount that I know will eventually, after the procedure, bother you, even if it means it'll take me a little bit longer, or if it'll be a little bit harder for me to actually do it. I just want to make sure that you're feeling the best after. So I've had patients that have had complications that started treatment somewhere else, or even locally somewhere else that was a lot cheaper, and then there's infections and there's complications, and now I have to fix them, right? So now we're at a different spot, and it just becomes so much more expensive and so much more annoying, and I never want you to suffer or be in pain. So it really kind of annoys me when somebody has an implant experience that's nothing but seamless and comfortable, because that's really the way that it should be. So make sure that you understand that having an implant done in the right hands with the right provider, most importantly, the person that you trust the most, not only the hands, but the actual person. You feel comfortable with them, with your provider, because that's really ultimately what matters. So don't get discouraged from other stories of other people that they've experienced with implants. Just find a really trusted provider and ask them the questions, because truthfully, it's one of my favorite things because it's just so much better than the myth out there of just how horrible it could be to have an implant. It's actually quite fun and quite seamless and comfortable for you guys. So make sure that you choose somebody that you're comfortable with, and if you have any questions, just leave some comments here.